Hi, I'm Dr. Kirsten Lloyd. We're continuing on with treatments for obstructive sleep apnea and shifting gears a little bit for this video to cover surgical options for sleep apnea treatment. Now, most sleep specialists will agree that surgery is considered second line or only if our non-invasive therapies like CPAP and oral appliance, Bongo, Excite OSA, all of these treatments that we've been talking about so far, if those are not successful in achieving the results that we need, or if someone cannot tolerate any of those non-invasive therapies, now it's time to talk about surgeries. So bear with me, there are a lot of surgeries to treat obstructive sleep apnea, and it's gonna take us a couple minutes to get through them. But surgery, really is looking at one main aim, which is to reduce physical obstruction to airflow. And physical blockages to airflow can occur in the nose, in the palate, in the sinuses, in the tongue. So all of these surgical techniques are aimed at those specific blockages. So let's start with options for nasal surgery. Nasal septoplasty is correcting a deviated septum, the septum being the dividing line between the two nostrils. If that's not straight, that can cause obstruction of airflow. Another nasal surgery is a turbinectomy. So when there's like outgrowths or polyps inside of the nasal passage, those create obstruction and can be removed surgically. There's also various sinus surgeries for the maxillary and frontal sinuses to reduce excessive tissue growth in there that contributes to blockage of airflow. Next, let's jump to tongue surgeries. Tongue surgeries all aim at reducing the size of the tongue, but not the entire tongue, the root of the tongue, which attaches at the base of the tongue or the back of the throat. So here we can reduce the bulk of the back of the tongue by radiofrequency ablation, by surgical glossectomy, actually cutting away a portion of the base of the tongue, as well as some robotic surgeries inside the mouth. Inside the mouth, we can also target the palate, which is kind of the back roof of the mouth. And the most common palatal surgery is called the UPPP, or a uvulopalato-pharyngoplasty. UPPP being, of course, much easier to say. The UPPP cuts away things like the tonsils, the uvula, which dangles in the back of the throat, and cuts away some of the soft palate, all with the aim of widening the airway. Probably the most invasive surgical approach is the MMA, or the maxillomandibular advancement. So the maxilla is our cheekbones here, and the mandible is the jawbone. An MMA surgery cuts through both of these and slightly advances those bones forward. This creates a wider airway, but can very slightly also change someone's facial structure. Right now, the most popular surgical approach that many of you have probably heard about already is the Inspire device. Inspire is one brand, and probably the most popular brand, of hypoglossal nerve stimulation. This is harnessing the technology of a pacemaker, but using it to control tongue motion versus, of course, a cardiac pacemaker is controlling heart motion or heart muscle movement. So very similarly, the Inspire device has a small battery pack that's implanted in the upper chest with leads, electrical wires, that go under the skin up to the hypoglossal nerve, which runs right here under the chin. The hypoglossal nerve's main function is tongue motion. So when your Inspire device is turned on with a remote control at nighttime, it controls the tongue muscle to hold it forward and out of the airway, again, creating a larger airway. Inspire is indicated for those who have moderate or severe obstructive sleep apnea who have tried and not gotten along with CPAP. We so far have just done a flyover view of the surgical approaches that can be used to treat obstructive sleep apnea. The conversation, of course, can be far more in-depth with your Empower Sleep specialist, and we'll help you decide if surgeries are right for you, and if needed, get you connected with an ENT specialist. Thanks for joining me today.